Another one interesting application of the Mahatiktaka and saribadyasava is its use in fistulas and nadi vrana, in use in anorectal diseases as well. As you know that most of the anorectal diseases happens because of two reasons. One is pitta vriddhi, that is ushna guna vriddhi. So many people know this because it happens because of heat, and that is improper vatanulomana. These two causes are the most important causes for formation of the anorectal diseases like fissure, bleeding piles, fistula, pilonidal sinus, etc. In smaller nadi vranas, smaller pilonidal sinus, low level fistula, etc., giving Mahatiktakam, saribadyasavam and avipatti churna are trivrit lehya. We have seen two things. One, we have seen disease getting cured. Number two, we have seen the risk of pus spreading even further. I had few patients who took Mahatiktakam, saribadyasavam and avipatti churna, who had low level fistulas and pilonidal sinus, and it did not disturb them ever since. It's been 4 years, 5 years, etc. And I gave this combination. They took it regularly for 3 to 6 months, and they report that their fistula or pilonidal sinus, it's present, but it does not bother me. So this is something that is really commendable. This is something that is really arguable, because in the present pilonidal sinus, in the presence of shalya, that is hair, getting result is almost difficult, and it can come back anytime. I even told them so. I even argue the point of getting result, but result is there. Definitely people accept it. If they take Mahatiktakam, saribadyasavam, trivrit lehya for low level fistulas and pilonidal sinus, it definitely works. That is why two things can happen. One, we can see that the disease is getting cured, but cured temporarily, but there is no guarantee that it won't come back. Okay, even for years together it may be under control. Number two, it reduces the risk of pus spreading even further. So even if they want to go for surgery or something, giving Mahatiktakam, saribadyasavam, avipatti churna delays the process and does not make it an acute disease, and it delays the process, etc. Especially for pilonidal sinuses, where I see that the particular diseases of pilonidal sinus and some fistulas, which are getting increased in March, April time, which is an extreme heat season. So giving Mahatiktakam and saribadyasavam in that particular time really reduces the risk of getting pilonidal sinus, and if they already got it, then it reduces the risk of pus spreading even further. When so much of pus is there, then you should not choose Mahatiktaka saribadyasava. For the pus to break down, you have to choose Ushna Kalpanas like Gugulu Tikta Gridam and Kashayam. But when it is in small stage, in just starting stage, or the pus has already discharged, then you can go for Mahatiktakam saribadyasava and avipatti karachurnam. That will be extremely helpful in anorectal diseases. I repeat, I have so many patients who took this Mahatiktakam and saribadyasava for fistulas and pilonidal sinus, and they till date they tell that it has not bothered them anymore without having any surgeries.